is Beulah Varghese, and for our final project, I've decided to do a data analysis and visualization on COVID-19. So a little background on the COVID-19 pandemic. As we all know, it has been ongoing. It's been an ongoing global health crisis that has been going on for the last 2-3 years. And it is an infectious disease caused by the SARS-CoV-2 virus that mainly affects the respiratory system. And the symptoms can vary among people, and although most experience mild to moderate illnesses that don't often require hospitalizations, a lot of others have been affected with serious symptoms that even end in death. So several vaccines have been developed since the start of the pandemic. And they have been distributed all over the world, and has contributed to a slowdown of the spread of the virus. So the problem that I'm going to be looking at is basically the effect of COVID across 3 different areas of society, basically. So the impact of the pandemic has been felt across almost all industries and domains of society. And the data analysis and visualization approaches in this project aims to study the effect of COVID-19 across these three areas. So first, I'm going to look at the spread of COVID and how the vaccine distribution has been affected across the countries. And the second problem that I'm going to be answering is how has COVID affected different races and ethnicities in the U.S. And the last problem that I'll be answering is the effect of COVID on healthcare services. So primarily, we know that hospitals have been hit really hard during the pandemic, so I wanted to see how COVID has contributed to healthcare services. So the motivation behind this data analysis is that the levels of COVID cases and deaths have been changing throughout the pandemic. Even though the introduction of vaccines have returned a sense of normalcy and the government has relaxed mandates and restrictions, cases are continuing to rise, and these patterns of the pandemic are likely to continue and has implications for government policies and healthcare services. So to analyze and visualize this data, the different sources of data that I've used are data from World Health Organization, from Centers for Disease Control and Prevention, and Our World in Data. And the software that I have used to do my data cleaning, analysis, and visualization is through Power BI. So to answer the first question, how has COVID spread among different countries, and has this had any effect on the distribution of vaccinations in those countries? So this is the first dashboard that I've created. So this first graph, you can see that the United States has shown the most and the highest number of cases, which is drastically higher than all the other countries. It's almost twice as much as the rest of the countries, specifically India. As you can see, it's 45 million, while the United States has 98 million cases. And the other 2 graphs show a global distribution of the vaccines. So this is a global map that shows the different countries that have a count of the total vaccines distributed. And so from this data, you can see that China has the most number of vaccinations administered, and India comes in second place. And even though America has the highest number of cases, they have a comparatively lower number of vaccines administered when you're looking at the rest of the countries and the amount of vaccinations that they have administered as well. And so the last graph in this dashboard, or the third graph in this dashboard, is showing the relationship between the cases and the vaccination. So as you can see here as well, most of the countries are clustered around this area, and you can see China has the highest, India is second, and United States is around the same level as the other countries, despite having a higher number of cases. And then I wanted to look at a closer view of the US data because, as we can see, despite having a higher number of cases, they do have a relatively lower number of vaccines. So to look at that, this graph shows the total number of cases in the US from January to the end of 2002. And you can see that despite the high number of cases, which is almost 100 million, if you look at this axis, you can see that the number of vaccines are comparatively higher, and they reach almost 600, a little over 600 million vaccines. So we can see that there is some discrepancy, most likely due to the fact that China and India have a much higher population than North America, and when you take into account things like the number of doses that may have been administered in less series. And so the next question is, what is the distribution of cases and deaths among different races and ethnicities in the U.S.? So this is to analyze how different minorities or underrepresented groups might have been affected. So you can see that the number of deaths in the U.S. due to COVID comprises a relatively smaller proportion in comparison to the number of cases. And so out of those cases, we can see that white non-Hispanics make up a higher percentage of those cases, and they make up a higher percentage of the deaths. And then we can see how that compares to how that stands in comparison to the population of those groups. So we can see that white non-Hispanics make up a larger share of the U.S. population, and so compared with that, you can see that they account for more number of cases and deaths in the U.S., whereas Hispanic Latinos, and they comprise about 18% of the population, but they also account for more than 20% of the cases and less than 20% of the deaths. So the third question I wanted to look at is, what has been the effect of COVID on healthcare personnel and hospitalizations since the start of the pandemic? So as we can see here, this first graph looks at a progression of cases among healthcare personnel over time since the start of the pandemic, and we can see a sort of repeating pattern where there is an increase from the end of 2020 to, and again at the end of 2021, sorry. And then I wanted to compare that against the number of hospitalizations, and we can see an interesting pattern in which the number of cases among healthcare personnel seems to follow the same pattern as the number of hospitalizations. And so this might reveal some correlation between the two, which is analyzed and visualized in the scatter plot, which shows that there is indeed a positive correlation between hospital occupancy and healthcare COVID cases among healthcare personnel. And so for the future work, it is difficult to predict the course of this pandemic as the distribution of cases shifts across countries based on different factors. However, this health crisis has resulted in changes that will have long-term effects for a variety of areas of society. More analysis will be needed to be conducted to see how COVID has impacted different groups, especially minorities, underserved healthcare workers, or underrepresented people in the data. And so we can try to see how they've been affected, whether in terms of whether physically, mentally, or in financial factors that might affect them. And so next, I wanted to show you the dashboard, some features that I've used. And so in Power BI, you can see that we can scroll down to see the rest of the countries, and you can see that a lot of them have less than 1 million in count of cases, and most of them United States has 98 million, and that contributes to most of the data that we see here. And in comparison to the vaccinations, one thing to point out is we can see that China doesn't even make it in the top, 5 countries with the highest COVID deaths, but we do see that when we hover over here, they have the highest number of vaccinations. And so here we can see as well, if we scroll, we can see the distribution of these lower countries here. And if we were to see that, we can see the United States ranges along those same values. And so the next visualization is the total number of cases over the years. We can see a progressive growth in the cumulative number of cases. And then if we were to see these individually as well, we can see that the white non-Hispanic group makes up a majority of the population, and they've contributed 53.50% of the cases, and 63.30% of the deaths come from this group as well. And so in the last visualization, again, we can see the progression of COVID cases among healthcare personnel. So right here we can see in 2020 of November 29th, they had a really high number of cases, and again in January 2nd, 2029, it hit a high as well. And the same progression can be seen here in both hospital occupancy and case count, following a similar pattern of progression over the years. And this shows the scatter plot of the correlation between case counts and hospital occupancy. So these are just the 3 dashboards that I have used to visualize COVID-19 data. And thank you.